Hello, my name's Dr. Alex Phoon. I'm a plastic surgeon from Sydney's Park Clinic Plastic Surgery, and today I'm going to be talking about the safety of breast augmentation surgery. So one of the first things to understand about breast augmentation surgery is that it is surgery, and surgery does have inherent risks associated with it. So even with young healthy patients, there's always a risk that something might go wrong. So it's critically important that the surgical team that are going to be looking after you are fully qualified, and the surgery is occurring in a fully accredited facility so that if anything does go wrong, and let's face it, it almost never does, but if it does, you're going to be looked after, because there is no shortcut when it comes to your health and your safety, and that is paramount for any procedure that you should be having done. Safety, safety, safety. And through that safety of the surgical procedure, you'll find your way to a beautiful clinical result, but you just cannot shortcut the safety side of things. So let's go through it step by step. So in our practice, we believe that there is no way that you could have this kind of surgery under a twilight sedation or local anesthetic. That is our personal preference, as well as the vast majority of plastic surgeons within our country. And the reason for that is that if we're sticking just local anesthetic around your breast, it's very difficult to completely make the area numb without going close to your upper maximum dose of local anesthetic. So what we would do is that we routinely give you a general anesthetic. So that means you have to be in a day surgical facility or hospital, and we have an expert anaesthetist that's routinely looking at all aspects of your care. Now, one question that people will ask is, how will you know that I'm asleep? Well, we'll put an additional monitor on your forehead to make sure that your brain waves are absolutely asleep, so there's absolutely no way that you can be awake while we're performing anesthesia on you. So you'll go to sleep, we'll perform the surgery, place in a lot of local anesthetic afterwards, so that when you wake up you should be very, very comfortable in the recovery room with a perfectly made surgical bra that's customized to you, just to hold that implant in the perfect position so you can recover over the next 4 to 6 weeks. So we don't routinely use drains. I know some surgeons will, although they're probably in the minority. The reason for that is we believe that our risk of getting collections or hematomas is exceptionally low, so it's not worth the risk of getting an infection associated with the drain. So yeah, so just to recap, you want to make sure your surgeon is fully qualified. We believe that you should be having this kind of surgery in a facility that it's properly accredited as a hospital or a day surgery, with a full anaesthetic team and an anaesthetist present. And if you're ticking all those boxes, you can be very confident that your surgery will or should go ahead without a hitch. Of course, complications can always occur, but that's why it's important to have it done with the proper surgical team, with the correct anaesthetic follow-up as well, so that all aspects of your care are looked after, not just the beauty of the final result, but also the fact that you need to make sure that you're safe when you're having the procedure. And there is no shortcuts when it comes to safety. Anyway, I hope this has been helpful, and I will talk to you again soon. Bye-bye.